people suffering from lifestyle diseases, obesity, and other hand we have malnourishment in the country, and that's what is affecting. So we're just trying to put up a panel here to kind of look at the challenges that the country has in terms of healthcare.
The patient's perspective is very much different from what we think it is. I can give you a simple example. I have been asking a few of my patients to get onto Twitter chats. There are patients, something like lupus. There's a lupus Twitter chat happening every alternate Sunday for 1 hour. So it is the best time for them, to get the most out of it. Be there on the Twitter chat for 1 hour and they'll get a lot of information. But what happens is, recently there was a Twitter chat about pregnancy with lupus, and 5 of my patients were very much in line. They were, they have been waiting for a long time in the plan they're conceiving. So I fished their numbers from the database. I called them up, told them that, see, this is the best time. You can get the best of information. Please log on. I was there as an expert for that. And throughout 1 hour, in fact, it was extended by 20 minutes. We had a great Twitter chat. Most of the questions solved. That 1 hour chat went on for 1 hour 20 minutes. But the problem is, none of my patients tweeted a single sentence, a single tweet came from my patients. I was very sad. I thought probably nobody really went on to, nobody attended the chat. So I was sad at the end of the day. The next day, my inbox was full. I had 20 DMs on my Twitter page, and these were all related to whatever I had discussed on Twitter chat the other day.
We find that the cultural and traditional aspects of the society here in India plays a very important role. Like for example, there are immense amount of searches, but when it comes to conversations, there are hardly any conversations. And the mapping of the conversations goes in such that there are certain conditions which are not so serious are discussed, but the ones which are very serious are not discussed, because people don't like to be classified as sick. Okay? I'll give you an example of something which you probably relate to. Many years ago, when initially sugar substitutes were launched, okay, they were targeted to diabetes patients. And then they realized that nobody wants to take it, because if I use a sugar substitute on the table, it means I am diabetic. And I don't want to tell the world that I am diabetic. Okay. So then that was changed later. The same thing applies, because people do not want to be seen as sick. They want to be, I'm fine, nothing is wrong with me. Okay, मुझे तो सिर्फ sugar का problem है. Example है this. They don't want to be classified. So that is why, that is one part. The second part is that on a cultural front, the implications. Those who begin to understand that if something gets tagged to me, what will be the implications for me from my career point of view, from my marriage point of view, from this point of view, as he explained. That is another reason. Therefore, you will find that in healthcare particularly, there are a whole lot of searches, and therefore passive consumption of information is much more than active conversations. This is changing a little bit from the younger generation point of view, because primarily it is the younger generation which is on the social media, and the older generation is probably only finding information online, but on the social media it is the younger generation, and that will change as the utilization of the medium improves, and as these people mature to do more things online, it will change. And that's a typical marketing curve, that initially it is always low and then it will accelerate. So that will happen as the culture, but we have to understand that India is a different country.
Can the content be that precise and that genuine, which exactly attracts the entire community? For a moment, can we stop thinking that they are doctors, and can we think that they are also human beings? There is no different version of a Microsoft Word or PowerPoint for them, right? So they are utility items that they also need to use, correct? Can pharma companies, can actually people provide them the same ethical framework? And these are all ethical stuff. Patient education, everyone talks about. Can we make patient education so interesting that doctor feels a part of getting involved in it? And can we use such technologies and tools to exactly go about it? So interesting is a lot you can do. So there's innovation, you can do paid media. Facebook knows when you're pregnant, right? And there's a very interesting way you can reach out and talk to someone as such. It's a very interesting way a doctor can reach out to a patient every week, sending an image of an ultrasound of how fetus look week by week, which is powered by a pharma company. Nothing stops like that. This is doctor engaging with a patient, where pharma company just supporting a patient education. We just have to rethink the way we think content. I think the content is very verbose right now. I mean, I'm from a non-pharma background, when I see all those 4-page brochures, I really wonder that how much you actually go and see, right? Can there be can those brochure be made as audiobook? Can we have a infographic or a videographic content approach to explain the entire content in just 2 minutes, right? Because you really have 2 minutes when you go and meet those medical guys. So I think content has to be relooked at, and if you do your content well in an ethical framework, there's absolutely no boundaries here, right? So
absolutely, I think content is going to be the king, and the context is going to be the queen. I think that's what we heard in one of the sessions. So I think content and context both need to go hand in hand.
What I try to do is encourage my patients, please keep a blog, which has nothing to do with my blog or my website. It's my patient's blog. And since she can express what her first person account is, what her feelings are, and you're right, out of 100 people, only one will do that. But because she does it articulately, her ability to connect with other patients is so much better that a lot of them will ask her questions rather than ask me questions. And sometimes if she's not sure about the medical information, she will counter check with me and say, you know, here is the emotional bit, but am I also making sure I'm providing the medical through so that not every woman is articulate. Within 15 minutes, not every woman is going to open up and spill her guts. But because I know what these other women are feeling, I can proactively ask them some of these questions and get them to open up. So they think, okay, yes, this doctor is technically competent, but at least he's compassionate and he's empathetic and he understands what my feelings are. So I think these are things which we can do proactively to help patients feel comfortable.
I just heard pharmacovigilance and social right. So what I understand, we have spoken to few pharma companies and what I understand is they are wary of doing social listening because of the fact that once you do this monitoring, you need to report that.
Some of these issues about, pharma companies not being allowed to market directly to patients, I'm not saying that. But if pharma companies instead took the approach that we don't just sell products, we actually help patients to take better care of their diseases. And the way we can do that is simple thing. Suppose you're taking insulin. You need to take the insulin, let's say 4 times a day. Your doctor tells you that, but you're often not compliant, you have other things to do, you forget. Suppose the pharma company, along with each insulin thing, provided an app. You could set reminders to yourself that I need to take, the doctor is going to be happy, the patient is going to be happy because, compliance is better. These are long-term things. So these are simple things which people can do. So that's what I meant about there are all these opportunities, but you need to look at the world through the lens of the patient and what the patient goes through. And I think once we're doing that,
I think it's a fantastic question which exactly you've asked. And I've seen how pharma companies work, and I've seen the amount of stringent checks which have gone through medical and legal and various places, and only after that exactly gets published. You know what? I'm not saying researching is bad, but if I'm a patient, finding a medicine online is like being my own psychiatrist, right? It is very important, and I love the approach of pharma companies where they are doing patient education via doctors. If you really want to really ask the doctor where should I look for, please go and ask your doctor, he'll tell you, right? These are the right places you should hunt for information. Like how you trust your doctors on the right amount of medicine, that which dose should I take. Please also, for God's sake, trust him that where should I look for information because they are the experts. It is not about digital media, but it's about the content, and the content is verified by them. So I think the practice, and I love the way the pharma companies are approaching right now, is patient education via doctors, only if doctors endorse, only that the content has some substance and some readability, some easy to consume kind of way. So I think that approach is ethical approach, which I think is a very well to go ahead.